grand for a baby.
I wonder if you could tell me how expensive you think calling an ambulance out.
$100, $200?
$2.5 grand.
Imagine this. Every year, the US economy loses over $1 trillion because of diseases we could prevent. Obesity, diabetes, and heart disease aren't just personal health issues. They're an economic crisis. And guess what? It's not getting better. The system doesn't just fail to prevent these diseases, it profits from their existence. Today, we're diving into the staggering cost of preventable illness, why it's destroying America's economy, and what we can do to stop it. Let's get into it. Preventable diseases account for 7 out of 10 deaths in the United States. That's 70% of all deaths. Managing these illnesses costs us a staggering $3.7 trillion annually, or about 19.6% of the US GDP. For comparison, that's larger than the GDP of Germany, the 4th largest economy in the world. But it's not just about money. These diseases rob people of their time, their families, and potential. And the sad part? Most of these conditions, like heart disease, diabetes, and obesity, are preventable with early intervention. Yet, prevention programs are often the first to get cut when budgets tighten. Here's where it gets dark. Prevention doesn't make the same money as treatment. Think about it. If you're a pharmaceutical company, what's more lucrative? Selling a lifetime supply of insulin or teaching someone how to avoid type 2 diabetes in the first place? The system is designed to treat symptoms, not root causes. And let's talk about lobbying. In 2022 alone, pharmaceutical and healthcare companies spent over $379 million lobbying Congress. That's more than any other industry. Policies that could prioritize prevention, like taxing sugary drinks or subsidizing healthy food, often die in committee because they conflict with corporate interests. Let's break it down. Obesity alone costs the US economy $173 billion each year in medical expenses and lost productivity. Diabetes adds another $327 billion annually. And heart disease piles on with $219 billion in direct medical costs. The burden isn't distributed equally. Low-income communities, particularly communities of color, are hardest hit. They're stuck in food deserts where a bag of chips costs less than fresh produce. Gyms are non-existent. Stress levels, exacerbated by financial insecurity, fuel chronic illnesses. It's an endless cycle. So, what's the alternative? Let's talk solutions. First, we need national policies that prioritize prevention over treatment. For example, Finland reduced cardiovascular disease rates by 80% through public education campaigns, food subsidies, and aggressive health initiatives. The results were transformative for public health and their economy. And companies can play a role too. Some already offer gym memberships and wellness programs to employees, but it's not enough. The US needs a cultural shift where preventive care is valued as much as curative medicine. We need to incentivize healthy behavior, not just punish unhealthy ones. But here's the thing, you don't have to wait for Congress to act. There are steps we can take right now. Advocate for healthier school lunches in your community. Support local businesses that promote wellness. And if you can, prioritize your own health. exercise, eat well, get those health screenings. When you're healthy, you're sending a message to the system. You won't be part of its profit cycle. And let's not forget to hold policymakers accountable. The next time you hear a politician talk about lowering healthcare costs, ask them what they're doing to prevent disease in the first place. Prevention isn't just about saving lives. It's about saving our future. Here's the takeaway. Preventable diseases aren't just a healthcare issue. They're an economic and really a moral failure. We have the knowledge, the resources, and the tools to change all of this. So let's start. Share this video. Help spark the conversation. Because together, we can fix this broken system. Thanks for watching, guys. Stay dynamic. Peace.